Hi everyone, Dr. Campbell here with a real world coding scenario. For this scenario, I want you to visualize yourself as the certified coder who is working on behalf of the surgeon. In the real world, we would utilize a CPT code to show what happened today, and then an ICD-10 CM code for why the service was provided. Let's take a look at a scenario. So we have a patient that has a pre-op and post-op diagnosis of a malignant melanoma, upper chest, 1.5 centimeter. The procedure that was performed is stated as a wide excision of a malignant melanoma of the upper chest. One thing that you should know that's very important is that you should never code your procedure from the header of the report. You must read the body of the report to confirm what was actually done. So here the upper chest was prepped and draped in the sterile fashion. A margin of 2 centimeter lateral and medial around the lesion site was taken. The incision was carried down to the muscle fascia, which included the specimen, and then bleeding was controlled by electrocautery, and then they closed this defect with a single layered closure. Steri strips were applied, bandage was applied, and the patient tolerated the procedure well. The pathology report later indicated a malignant melanoma. Now, let's talk about diagnosis coding for a second. So, coding rules state that we always code the post-operative diagnoses as the confirmed diagnoses because it is the most definitive. However, if we have a pathological diagnosis, the pathology report is in, we're going to go with that. Well, in this case, they did confirm that it was a malignant melanoma. So the first thing I'm going to do is take out my ICD-10 CM coding manual and capture my code for a malignant melanoma of the skin on the chest wall. So just like CPT coding, diagnosis coding starts by identifying a main term in the alphabetical index. And for this particular patient, because this is a melanoma, that's going to actually be my main term. All right, so I'm here looking at melanoma, and let me show you the top of the page so you can see that I'm at melanoma. So that's melanoma, and I'm going to go to melanoma of the skin, and then the lesion was on the chest wall. So the index tells me C43.59. So the next thing that I'm going to actually do is verify C43.59. Okay, so C43.59 says malignant melanoma of other part of the trunk. All right, so I'm done with my diagnosis code, again, C43.59. Now, let's talk about a CPT code. And let's actually type this here so we can have it for reference. We'll put a green box around it because green means go. All right, so now this was an excision of a lesion. And what you want to think about with regards to excision of a lesion and CPT rules are, first, you have to know the type of lesion. Is it benign or is it malignant? And let's actually capture this down here at the bottom. So we have to know the type. We have to know the site. We have to know the size. And then we have to know the type of closure. So we know that this is actually a malignant neoplasm, and the site was actually on the skin, and it was the chest wall, the size. Now, per CPT guidelines, code selection is determined by the greatest clinical diameter of a lesion plus the margins. So here we have the lesion measuring 1.5, they told us at the top, and then there was a 2 centimeter on the lateral side, and then a 2 centimeter on the medial side. So if you add those together, that gives you a total of 5.5 centimeters. And then the closure was simple. And since it was simple, it's included in the code for the excision of the lesion. So the next thing that I want to do is take out my CPT manual. And in the CPT manual, I'm going to, in the index, actually go to I'm going to use the main term of skin because skin is actually a good place to start here. Now, you can use other terms like you could use lesion, you could use excision as an option, but I'm going to go with skin. And then under skin, I'm going to go to excision. Okay, so I'm looking at skin. And then under skin, I'm going to go to lesion. And under lesion, I need to go to malignant. My range of codes is 11600 through 11646. So then the next thing that I'm going to do is actually verify that code number. And don't forget, with excision of lesion, you got to make sure that you have the right anatomic site to get to your code. So the index told me to start with 11600. Well, immediately, one of the things that I noticed is that 11600 includes the trunk, and the chest wall is part of the trunk. So now, since I know I'm in the right anatomic family, I just got to find the right code for my size. And my size, remember, was 5.5. And so let's see here. 11606 would be my final code. So for the CPT, I have what happened today, which is 11606, and then why it happened, I have C 43.59. Well, guys, this has been a real world coding example. Thank you so much for listening and happy coding.